This week, roughly 800 Americans over 60 will fracture a hip. Not from a car accident, not from a fall downstairs. From an ordinary walk, flat ground, familiar neighborhood, nothing unusual. The difference between them and everyone watching right now isn't luck. It's three specific muscles that either work before you walk or don't. Strokes don't kill most seniors, falls do. And the majority of fall-related fractures in adults over 60 happen not on ice, not on stairs, but on flat ground during ordinary walks, because the muscles that keep you stable have quietly switched off. In my 28 years working with patients over 50, I've seen this exact pattern hundreds of times. And in the next 20 minutes, three things. First, the specific muscle group that shuts down after 50, and why your doctor has probably never mentioned it. Second, the hidden movement flaw that turns every walk into a slow injury waiting to happen, and how to spot it in yourself in 60 seconds. And third, three exercises so simple you can do them in your living room before you put on your shoes, that can change how your body moves for the rest of your life. That third one surprises every patient I show it to. Stay with me to the end. But first, you need to understand what's actually happening inside your body after 50, because the problem isn't your fitness level, it's something else entirely. If you've been told to just walk more, and you've tried, and your knees ache after a quarter mile, your lower back tightens up by the time you get home, or you feel unstable on uneven pavement, that's not a weakness. That's not age. That's your body telling you something specific is wrong with the sequence. You've been handed the right prescription with the wrong instructions. Walking is extraordinary medicine. A 2022 analysis published in the British Journal of Sports Medicine tracked 78,500 adults and found that people who walked at least 7,000 steps daily reduced their all-cause mortality risk by 50 to 70% compared to sedentary adults. That number should stop you cold, 50 to 70%. But that same benefit becomes a liability when three key stabilizing systems aren't firing before you take a single step. And after 50, those systems go quiet. Not from disease, not from injury, simply from the way modern life is built. I know some of you watching right now have stopped walking altogether because it hurts too much. And I know some of you are pushing through pain every single day because you've been told movement is good and stopping is giving up. Both of those approaches are wrong, and I'm going to show you the third option. Before I show you the exercises, though, you need to understand the muscle group that started this whole problem. Let's start with the most fundamental question most people never ask. What actually keeps you upright when you walk? The instinctive answer is your legs, your quads, your calves, and yes, they matter. But the engine behind stable, pain-free walking isn't your legs. It's a cluster of three muscles sitting deep in your hip and pelvis that most people over 50 haven't consciously activated in years, maybe decades. The gluteus medius, the hip flexors, and the deep core stabilizers. Specifically the transverse abdominis, which wraps around your spine like an internal back brace. Here's what happens to those muscles after 50. We sit in cars, at desks, on couches, and those muscles, which evolved to be loaded, stretched, and contracted thousands of times a day, essentially go to sleep. Physiologists call it gluteal amnesia. And while the name sounds almost funny, the consequences are not. When the glute medius stops firing properly, your pelvis drops every time you lift one foot off the ground. You can see it in yourself right now. Stand up, lift one knee slowly, and watch what happens to the opposite hip in a mirror. If it dips, even slightly, your glute medius is already underperforming. That drop, repeated thousands of times across a 30-minute walk, translates directly into knee pain, IT band tightness, lower back compression, and hip impingement. Your body isn't falling apart, it's compensating, brilliantly actually, for a muscle that stopped showing up. A 2019 study out of the University of Salford followed 312 adults over 55 with chronic knee pain. In 86% of cases, researchers found measurable weakness in the glute medius on the affected side. Not arthritis, not cartilage damage, muscle inhibition. 86%. Margaret, 58, came to see me from Phoenix 2 years ago. She had stopped walking her neighborhood loop, something she'd done every morning for 15 years, because the outside of her left knee had become too painful. Her orthopedic surgeon had mentioned the possibility of a meniscus procedure. She was terrified. When I assessed her gait, her left hip was dropping almost a full inch on every right foot strike. Her glute medius had been quietly offline for who knows how long. We didn't touch her knee once. 8 weeks of targeted hip work and she was back on her loop. No surgery. Now, understanding which muscles are involved is only the first layer, because there's a second problem. And this one's more surprising. There's a specific movement flaw baked into the way most people over 50 actually walk. And if you don't correct it before you start racking up steps, you're reinforcing the injury pattern every single day. So now you know what's quiet in your body. The next question is, what's your body doing instead? When the deep stabilizers stop working, the body is ingenious about finding workarounds. It shifts the load. And the two most common compensations I see in adults over 50 are what I call the forward lean and the lateral swing. The forward lean happens when the hip flexors are tight, which they almost universally are after 50. When your hip flexors shorten from years of sitting, they pull your pelvis into an anterior tilt. Imagine your pelvis as a bowl of water. A forward tilt tips the water out the front. That tips your center of gravity forward, and your torso leans to compensate. Now your lower back is bearing load it was never designed to carry, and every step locks in that compression a little more. The lateral swing is the glute medius compensation. When the hip can't stabilize laterally, the body swings the opposite shoulder to counterbalance the dropping pelvis. Watch any crowded sidewalk for 5 minutes. You'll see this in nearly every adult over 60. Small side-to-side sway. Not obvious, not dramatic, but constant, cumulative, and directly correlated with fall risk. A landmark study by Dr. Kathleen Gilbody at Boston University tracked gait parameters in 450 community-dwelling adults over 60 across a 5-year period. Adults who showed measurable lateral trunk sway during baseline gait assessment were 2.7 times more likely to report a fall within the following 24 months than those without it. 2.7 times. And here's what makes this genuinely difficult. These patterns feel normal. They've been your walk for years. Your nervous system has mapped them as default. You're not going to feel them unless you know what to look for, or unless you've trained the underlying muscles enough that your body has a better option available. This is why the 3 exercises matter so much. They don't just strengthen muscles, they re-educate the movement patterns. They give your nervous system a new default. If you're still watching, this next part is the most important. Most people who find this information stop here. They understand the problem intellectually but don't change anything. If you stay with me for the next 5 minutes, I'll show you the specific exercises and the exact sequence that physical therapists use with post-surgical patients to rebuild this system from scratch. It works the same way whether you've had surgery or not. But before that, one thing about safety. These exercises are appropriate for most adults over 50 without recent joint surgery or acute injury. If you're recovering from a hip or knee replacement in the last 6 months, check with your physical therapist before starting. This is general guidance, not a substitute for individual medical assessment. Because what I'm about to show you in point 3 is the part my patients always tell me they wish someone had shown them 10 years earlier. This is the one. 3 exercises, done in this exact order, before every walk. The order is non-negotiable. This isn't 3 random exercises. It's a sequence engineered to wake up the system in the right way. First, you release the thing that's overworking. Then you activate what's been quiet. Then you integrate both into a movement pattern your nervous system will actually carry into your walk. Exercise 1, the 90-90 hip release. Sit on the floor with both knees bent at 90 degrees. One knee in front of you, one to the side. This is the 90-90 position. Your front shin is parallel to your body. Your back shin is parallel behind you. Sit tall. Now simply let gravity do the work. You're releasing the hip capsule and the hip flexors. The tight structures pulling your pelvis forward. Hold for 90 seconds on each side. Not 30 seconds, 90. Research from Dr. Thomas Meyer's fascial work, and later replicated in clinical studies on hip mobility in adults over 50, consistently shows that connective tissue requires a sustained load of at least 60 to 90 seconds before it begins to respond. Shorter holds feel good but don't change the tissue. What you're feeling, that deep pull in the front of your back hip and the outside of your front hip, is your target tissue. Breathe into it. Don't push through sharp pain. Mild to moderate discomfort is appropriate. Sharp or shooting sensation means back off. Patricia, 63, from Nashville, had been waking up every morning with lower back stiffness so severe it took her 20 minutes before she could walk normally to the bathroom. She'd had imaging done, no significant findings. When I put her in this position for the first time, she lasted 11 seconds before needing to come out. Her hip flexors were so locked down, they'd essentially fused her into a seated posture even when she was standing. 6 weeks of this single exercise done every morning, and her morning stiffness dropped from 20 minutes to under 2. Her walking speed, measured on a 10-meter timed walk test, improved by 22%. Nothing else changed. One exercise. Exercise 2, the side-lying clamshell. Lie on your side, hips stacked, knees bent to about 45 degrees, feet together. Now, keeping your feet touching, lift the top knee toward the ceiling, rotating at the hip, not rolling your pelvis back. Your top hip opens like a clamshell. Hold the top position for 2 full seconds. Lower with control. 15 repetitions each side. Slow, controlled. If you feel this in your outer thigh and into your glute, you're in the right place. If you feel nothing, your glute medius is more inhibited than you think, and you may need to place your hand directly on the outer glute to give your brain a proprioceptive cue to find it. A 2021 randomized controlled trial published in the Journal of Orthopedic and Sports Physical Therapy tested clamshell variations in adults over 55 with hip abductor weakness. Participants who performed the 2-second isometric hold at the top showed 34% greater glute medius activation compared to those who performed the movement without the pause. 34%. The 2 seconds aren't optional. Exercise 3. The standing hip hinge with heel touch. Stand near a wall or sturdy chair. You're not holding it, it's just there for confidence. Stand on your right foot. Very slight bend in the right knee, not a squat. Now hinge forward at the hip. Chest drops, left leg floats behind you, spine stays long. You reach your right hand toward your right heel, touch it lightly, and return to standing. This is the integration exercise. It combines the hip flexor length from exercise 1, the glute medius activation from exercise 2, and adds balance and proprioceptive demand. This is what teaches your nervous system to use the new patterns. 8 repetitions each side. Slow enough that you feel the moment of instability and work through it. That moment, the wobble, is not a failure. That's the adaptation signal. That's your nervous system building new maps. The entire sequence takes between 9 and 12 minutes. Before every walk, every time. Here's exactly what I want you to do this week. Day 1, learn the sequence. Don't walk yet. Go through all 3 exercises back to back and notice how your body feels. Notice where you're tight, where you feel nothing, where you feel the most. Day 2 onward. Do the sequence before every walk. Walk for whatever duration feels comfortable. End when you feel good, not when you're exhausted. You're training a system that responds to consistency far more than intensity. Keep a simple note on your phone. Date, exercises done, walk duration, how your knees or hips felt during and after. You don't need an app. 3 lines in your notes. After 2 weeks, read it back. Most people are genuinely surprised by how much changes in 14 days when the right inputs are in place. Talk to your doctor or physical therapist about these exercises, especially if you have a diagnosed hip or knee condition. These movements are widely used in PT settings and are appropriate for most adults, but your provider knows your history and can tell you if any modification is needed. One more thing, don't increase your walk distance more than 10% per week. The body adapts beautifully, but it needs time. The limiting factor after 50 is almost never cardiovascular fitness. It's the tendons, the joint capsule, the connective tissue. Those adapt 3 to 4 times slower than muscle. Patience isn't passive, it's a strategy. Your body has been carrying you for over 50 years. It knows how to adapt. It knows how to heal. It just needs the right signal and a little more preparation than it did at 30. 9 to 12 minutes before your walk. 3 exercises in order. That's the whole prescription. If what I shared today helped you make sense of what's been happening in your body, next week's video will go a level deeper. We're looking at the single balance drill that the world's top fall prevention researchers say should be standard practice for every adult over 60, and almost none of them are doing it. Your legs have never stopped working for you. Don't stop working for them.